Hello and welcome to the first of our Ascent series webinars from the Sorenson Impact Center. We're excited to have all of you here with us. We had more than 300 people register for this event today. I'm Katie Macc, COO at the Sorenson Impact Center. The Sorenson Impact Center connects capital to impact through innovative finance structuring, impact measurement, and impact strategy. We are proudly housed at the University of Utah's David Eccles School of Business, where we also help train students to be future leaders in impact. Today, I'm joined by my colleague and Senior Director of Impact Measurement at the Center, Dr. Tiana Rogers, and Dr. Paul Kuttner, the Associate Director at the University Neighborhood Partners at the University of Utah. Dr. Kuttner is the Associate Director at UNP. For over 20 years, UNP has built mutually beneficial partnerships between the university and West Side Salt Lake City neighborhoods. Dr. Kuttner leads UNP's work in community-based research and evaluation, as well as supporting the growth and evolution of the UNP network. As a scholar, his research and teaching focuses on the relationships between educational institutions and communities that have faced marginalization and oppression in our school systems. Trained as an educational psychologist, his research is carried out in collaboration with youth, families, educators, and other community partners. Welcome, Dr. Kuttner. Dr. Tiana Rogers is a Senior Director of Impact Strategy at the Sorenson Impact Center. An impact measurement expert, Dr. Rogers helps corporate, government, and nonprofit entities utilize data to solve social problems and increase their impact. Her career has focused on conducting research and serving as a field expert in the areas of homelessness, child welfare and maltreatment, public health and policy, and racial disparities. In addition to being a published author with teaching experience, Dr. Rogers also consults with national and international social service organizations on impact measurement, program evaluation, and impact strategy. Dr. Rogers and Dr. Kuttner will share how the center recently helped UNP identify approaches to better demonstrate their impact and ensure community priorities remain at the core of their impact measurement efforts. Our goal for today, for all of us, is to walk away with 3 important takeaways. Number 1, we want to have a clear understanding of social impact measurement, what it is, how to apply it, and how it can advance our work. Number 2, learn how to identify existing data and apply it to impact measurement. And number 3, understand how to engage a community in evidence-based decision-making. Welcome to you all. I'm particularly excited today to hear from Tiana and Paul, because while I've noticed a surge in recent years to involve the community in the development of programs, I find it exciting and still quite rare, unfortunately, to see the evaluation of the projects, the impact measurement process, engage the community in the way that UNP and SIC did here. Dr. Kuttner, why don't you kick us off by telling us a bit about UNP and why Sorenson's expertise in this partnership was valuable?
Of course. Thank you, Katie. And it's an honor to be here with my colleagues and all of you. Thanks for joining today. So as Katie said, I work with University Neighborhood Partners. We are a department of the University of Utah that was created over 20 years ago to address the deep gulfs between the University of Utah on the east side of Salt Lake City and west side neighborhoods. The west side of Salt Lake City, if you know it well, is a major resettlement area for people who come as immigrants and refugees to this country, but it's also faced a long history of disinvestment and marginalization. And so over 20 years ago, there was a demand from communities and a recognition from the University of Utah that they needed to do something to be able to bridge this gap. And so at the time, Irene Fisher, who recently passed away, spent about a year on the west side of the city, talking to people, listening, developing an understanding of what was going on in the community, the strengths of the community, the life of the community, and really asking what role the university could play. And the result of that work was University Neighborhood Partners. Our mission is to bring together university and west side people and resources in mutual learning, action, and benefit, a community coming together. And what that means day to day is that our staff are building partnerships between higher education, community residents, community leaders, as well as local institutions and organizations to address an array of priorities from housing and education to healthcare and employment, while integrating the university's missions around research, teaching and service. So for the past few years, we've been developing a new system for evaluating this work, evaluating community engagement at the scale that we're working. Any one year, we have 40 to 50 different partnerships involving hundreds of leaders and thousands of people. Uh, it gets very complicated to think about how do you really assess and evaluate the work that you're doing when we're not doing sort of simple linear programs. We're looking to invest in systems change by addressing systems at multiple levels. So we've developed a framework for evaluating community partnerships that draws a lot on systems thinking and systems theories. And I'm not going to go deep into it, but I bring it up here to kind of give you a frame for where we were at. We've been working very close. We think of change as rippling out across multiple levels, from individual change of community members, of faculty, of students, and the way that they grow as leaders and learners, to group and organizational change as we build networks and organizations, and shift the way, build social capital and shift the way people work with one another, all the way out towards larger community-wide and institutional change. The first couple of years of our work, got we made some really strong decisions around the kind of individual change we're looking at and how we survey and do storytelling to gather that. We found really innovative ways of addressing group and organizational change using tools like network analysis. And the next stage we knew was really to think about this community wide change. How do we really think about the community level and institutional level change that these partnerships can be addressing, given the broad diversity of issues that they're addressing, the different systems? And so that was really the next step. And we didn't have a lot of capacity internally to be able to take on that large task. And it was really in that space that we were very fortunate to have the opportunity to partner with Sorenson Impact Center, who could put some real time and resource into thinking this through in a way that built on our model and our approach, as well as their expertise. So just to give the groups that we engaged with this, we specifically engaged three groups of community leaders, what we think of as community leadership networks that we've supported and fostered and collaborated with over the years. One is the Heartland Resident Committee. It is a group of primarily leaders of immigrant and refugee background connected to different linguistic communities on the West Side, each of whom is a leader in their community and does either has their own organization or does different programs with their specific community from the same country of origin. And they all come together in a committee to work collaboratively across groups. The second is the Utah Community Advocate Network. And this is a group of primarily Latinx families. It's a multi-generational group that works a lot on issues of education. And the third one is the newest. So for about 20 years, we were focused very strongly within Salt Lake City proper. And in the last couple of years, along with a larger effort by the university, we have expanded our geographic area into nearby West Valley. And we have developed a new group that has renamed itself West Side Community United. This is a very racially, linguistically, and ethnically diverse group that is engaged in its own efforts to improve West Valley and connect with the university. I want to give a little brief approach about a brief talk about how we think about community engagement, because it has a lot to do with the model we put, and I can dive into this a little more later. When people talk about doing community engagement from institutional or organizational standpoint, a very common approach is what I think of as an outreach model. It involves an institution, say the city wants to do a new project and it wants to get community input on the project. And they reach out to individuals through surveys, through going out on the street and talking to people, very focused on talking to individuals about their individual opinions. There's some strengths to this model. I think one is certainly from a researcher perspective, you can do some sort of more random sampling and kind of get a broader, get a representative landscape of what individuals think. But there's a lot of drawbacks. Usually it stops after that. There's usually not a mechanism to be able to continue working with these individuals who, after all, are just individuals who had one contact with the city. And so power and decision making remains with the institution, and it gets a lot of good input, but it's not very collaborative usually. So we use a different model, which I refer to as the snowflake model, drawing on the work of Marshall Gans and his work on leadership for social change, particularly around social movements. So in the snowflake model, we don't try to individually go out to every single person in the neighborhood, although we do have events and some things that are broadly attended. A lot of our work is done specifically with community leaders, with individuals who in turn are working with others in the community who have strong networks, who have relationships. Maybe they have an organization. We work with groups like the Somali Community Self-Management Organization, who works deeply in the Somali community. So we work with leaders who then work with their community to engage. And there's a lot of benefits to this. You can engage a lot more people, because you're working through people. You're not trying to have your staff directly engage with each individual. The power is more shared because those leaders come to the table not just as individuals, but bringing the voice of their entire community and the power of that community to accept or reject or push back against what you're doing. And once you do develop something through this kind of engagement, you have a team of leaders who you can do this work with together, who are invested and ready to move forward. And so this that allows you to really begin to take what you're learning together and really build a partnership and take action together. I can speak a little bit more about that as it relates to this project, but I will pass it back to Katie before we move into describing the project itself.
Absolutely. Thanks so much, Paul. I really love that last visual that you put up. It really helped make it clear to me how you guys are approaching this community engagement work. And I'm wondering, as we wrap up this portion of it, if you could just highlight one or two of the major challenges you face when you're engaging the community in the impact measurement process.
Sure. I think there's a lot of challenges. I think um, when you approach community with your framework, we're coming with the idea of impact measurement. That is not a framework that has come from the community. That's one we're bringing. So it can often come with just skepticism that it is. That it's a valuable use of their time, particularly because we're working with leaders who are doing a lot in their communities already, usually unpaid work on top of jobs in other ways. So, they have to be very careful with their time and investment in this work. And so we work through that a couple ways. One is relationships. So this project would not have been possible without many years of relationship building. We have supported their priorities. We have supported their organizations. They are more willing to come to the table and consider this new idea that we're bringing up, that University Neighborhood Partners wants to be involved in. And then the second is we go to them. It was very critical, as we'll hear, that we and Sorenson Impact Center staff, we went into the spaces they were already meeting, the work they were already doing, and we coordinated with them to design our agenda. And so by doing it collaboratively and by integrating it into their system and community spaces they cared about, we made it much easier and more comfortable for them to engage and more useful for them, I think, in the long run.
Yeah, yeah, yeah. Thanks so much, Dr. Kuttner. As a reminder to all of our participants today, we want this to be a two-way conversation. So if you have any questions, whether they're relevant to an exact slide or something that one of our presenters says, or broadly to the topic, please drop them in the chat and we'll have a chance to address some of those questions towards the end of our time together today. So please feel free to use the chat widely. Dr. Rogers, why don't you take it from here and describe how Sorenson went about helping to structure this project with UNP?
Yeah, absolutely. Thank you, Katie. So, our team had the pleasure of partnering with Dr. Kuttner's team to do some very important impact measurement work. And so, as he noted, we worked with three of their pre-existing community partners. And so, our goal of this engagement really was to understand the priorities of these communities. And as Dr. Kuttner also alluded to, we did not come with our own ideas about what those priorities would be. We allowed the community groups that were already pre-existing to inform us around what those priorities were and how we could use data to measure the impact of those priorities. And so the second point or area that we focused on was actually looking at some of the strategies that UNP was employing as they were trying to capture their work with these leaders in these community groups. And so really it was about going back and saying, how can we capture more information about what is important? And then also, how can we do a better job at optimizing how we capture, um, whether we're doing a good job or not, right? And so our team was really instrumental in making sure that we centered the voices of those community partners. We made sure that we worked in tandem with UNP as we presented new ideas and offered up different ideas around how to optimize their approaches to working with the community. And so my team, which is listed here at the bottom, Trent, Nikki, and Brooke, were instrumental in helping move that work forward. And so when we went into these community spaces, we were able to capture a really long list of priorities. These working committees had already established these relationships. They had already been kind of having brain trust sessions around like, how do we address these things? And so when we came in, we ended up with over 20 priorities that the community entities had. And so they shared those with us, and we were able to compile all of them and prioritize the top 5. And so, as you can see here with this graphic, the check marks are representative of the working groups or the subcommittees that highlighted these as being priority needs. And so, the very first kind of high level need here, as you can see, is youth being successful in their education and having additional skills to really thrive in their communities and beyond. Then the second part was around health services and having access, having affordability, having culturally responsive care within these communities. And so these things, as we think about them as researchers, can be classified as the social determinants of health, right? Education and health are all critically important when we talk about what it means to thrive and be successful in a community. And so the third and fourth priorities are listed here. Those encompass mental health and also being able to celebrate the diversity and having representation when it comes to decision making. And as you can see in number 4, we had 3 committees that made this one a top priority, or 2 instead of the 3. And that was okay, right? We had the majority of the vote going to making this something that was really important and something we wanted to track and monitor over a period of time. And then the last priority that was listed among all of the subcommittees were having a sense of belonging is what how I'd like to describe it. And here it's detailed as, feeling connected, supported through community spaces and programming. And I want to make a note here that the language that is used to prioritize or describe these priority areas is language that came directly from the working groups. So my team participated in their meetings and they were able to kind of pull exact quotes out and use their exact language. So when we kind of compiled it all and said, hey, this is what we're hearing, we were able to share back out their exact language for how they talked about and described their communities and also how they described the things that were most important to them. And so the next step in the project, so we kind of started at the beginning, we captured that information, what we would describe as data collected. We went back to the community and said, hey, can you share with us? Are you willing to share with us what's important? And then what we did is we developed an actual assessment or an indicator, kind of like a scorecard, with the subcommittees. And so we came up with a framework and we said, hey, does this look right to you? How do we weigh, these priorities? How do we decide what's better, what's not as great, right? And so some of the assessment criteria that we came up with and co-created are listed here, right? So meaningful. It wasn't whether it was meaningful to us as researchers, it was whether it was meaningful to the community. And so we decided to identify indicators or pieces of information that would help us know whether the work was aligning with the goal, the vision, and the values of these communities. The second piece was whether the data or the work was within UMP's scope. And so, as an organization, UMP kind of, if you go back to that snowflake visual that Dr. Kuttner shared, UMP is in the center. And so they are reaching out to the community kind of champions or anchors, as we'd like to describe them, to say, hey, we want to support and we want to provide additional resource and capacity. And so our job at Sorenson was then to provide that strategic support and insight to UMP in doing their work. The third assessment here, criteria, was whether it was measurable. And this was an interesting assessment criteria because, of course, as researchers, we have our own definition of what is measurable, right? However, it was important for us to also consider factors such as feasibility and affordability, right? When we work with communities, it's important that we consider, particularly when we work with communities around impact measurement, it's important that we consider the sustainability of that process, right? And so part of that is considering, can it be easily collected? Can there be resource designated to collect this data or to even analyze this data or report this data out? And how affordable is that for this specific community at this given point in time? And so measurable was a good one. We were able to work around that one and make it reach kind of the standard that was agreeable for all parties. And then the very last criteria was about credibility, right? And so we wanted to make sure that the information or the indicators or the data that we were pulling to measure the impact tied directly to the actual issues or the priorities that the community members were cared about, okay? So following that important work, we were able to come up with some very high-level recommendations for UMP, but also some additional kind of granular recommendations that could be taken back to the working committees and implemented in real time. And we also kind of ranked those impact measurement strategies based on time, capacity, resource. And so there were some that were a little more, what we like to call low-hanging fruit, where they could address more quickly, whereas some were more longer-term goals. And so as we think back on the project reflections of this work, there were 4, I would say, high-level kind of takeaways that we want to think about or nod to when we think about community-engaged impact measurement. And one of that, the first primary point is co-creation, right? We are coming in and we are lending our expertise, and the community is lending their expertise to us. And so that is an important process, okay? The second part is actually recognizing that it is a process, right? It's not a one and done type of thing. And it's oftentimes people think of impact measurement as kind of like linear, in that there's a definitive like beginning and end point. But for us, it's very, very iterative, right? It's deliberate and it's iterative, and it's something that you come back to and you say, did we get that right? Are we getting it right? And then you make adjustments in real time to your strategy. The third part is that it's a scalable solution, right? And so the question here that we often ask is, does the impact measurement approach meet the resources and the capacity of the organization? And so kind of how I mentioned on that previous slide, we have to think about those considerations. Can there be resource dedicated and time and all of those things linked to engaging in authentic impact measurement, community engaged impact measurement? And then the last piece is visual design, right? So for us, as researchers, being in a kind of institutional setting at a higher ed institution, we can sometimes come up with these amazing ideas. However, the ability to communicate those things out to community in a way that is meaningful sometimes falls short, right? And so for us, it's super important when we do community engaged impact measurement to have in partnership with kind of text or script, is to have visual displays or visual design and aesthetically pleasing deliverables or final products to highlight those key messages and those key takeaways for folks to be able to um, digest, in their own way and ask questions as they see fit. So with that, I will pass it back to Katie.
Thanks so much, Dr. Rogers and Dr. Kuttner. Now we're going to turn to the questions part of our presentation today. And just for our audience out there, I'll start with a couple of questions that I have. I could take us well past our time with the questions that I have, but we will get to audience questions. I'll hold back. So I've noticed there have been a few questions already posted in the chat. Please continue to drop your questions in the chat and we'll filter through those, get to as many as we possibly can before the end of our time today. So my first question for us now for Dr. Rogers and Dr. Kuttner, because your answers might differ slightly, is how would you go about defining community when you're doing community engagement? Because as we know, that term can be so broad, but also how you define it very much determines the voices you hear and the direction you go. So I'm curious what that process looks like. Maybe Dr. Rogers, do you want to kick us off? And then Dr. Kuttner, you can add.
Yeah, sure. So I think for me, as a kind of a social science researcher, community is whoever is impacted or potentially impacted by a specific intervention, effort, decision, and that can be sometimes difficult to map. It can be. It's not always as black and white, right, as we'd like it to be. And so I think that is where we have to be thoughtful in partnering with entities like UNP, like Dr. Kuttner's team, to say, we don't know, right? Be willing to say, we don't know who this could potentially impact, but you have those relationships and we have those. You have that long-standing kind of history and trust built to be able to kind of tap into that knowledge that we aren't always privy to in higher ed institutions.
Yeah, I'll just say, I mean, there's so many ways you can define community. For university neighborhood partners, we do start with a geographic idea of community. So we have specific neighborhoods in Salt Lake City and West Valley City that we work with. But I think it's helpful to know that what you can call that one community, but it can also be thought of as a set of overlapping communities, like sub-communities that often overlap with groups outside of the neighborhoods. So we also engage with people who have family connections in the neighborhoods, who used to live in the neighborhoods but got pushed out because of prices and things like that. So it's kind of it's a flowing thing. And sometimes we talk about community as our entire community, more in what Dr. Rogers said, that includes the university, or at least those parts of the university that recognize their investment and that they have a shared fate with the West Side. So we kind of have to switch around and move it to different scales. I will say that we do make an effort to both engage any part of the community that is interested, any part of the neighborhoods that is interested, and making sure that we lean into engaging with parts of the community or sub-communities that have been left out of decision making, that have been marginalized within higher education, because there's more distrust, there's more work to do to make sure that those relationships are strong.
Yeah, that's super helpful. And that leads me to the second question I have, and maybe Paul, you could kick us off on this, but can you talk to us about the importance of trust in this process? You referred to it in your presentation earlier, and then not just the importance, but also how you went about and how you have gone about building that trust over time.
Sure. I mean, briefly, I'll just say that trust is everything. I mean, all of this is relational work. You need to be in relationship with people in the sense that you are engaging with them authentically, fully, that you in a way that you allow yourself to be changed by them, that you come with humility. And then there's lots of things you can do. I mean, I'll say this, some of these, 2 out of the 3 of those groups existed long before I joined University Neighborhood Partners 7.5 years ago. So a lot of this trust and relationship is built over decades. and decades of supporting one another, decades of investing and showing that you believe in what other people want. I think the worst thing you can do when building trust and partnerships is to come with your agenda and try to push your agenda and not be willing to support their agenda and sort of change together. So years of not leaving the neighborhoods, the years of being around, of showing that you are committed. There's a lot more to it, but it's a very human thing that I think a lot of us can recognize in our own lives.
Yeah, I love that simple phrase of years of not leaving. Just as simple as that, right? Years of not leaving, because how often do organizations or projects or pilots come and go from communities versus just saying, we're here and we're just still going to be here. The same email address you used before, the same phone number you called, like we're still just here showing up at the meetings. Years of not leaving. It's definitely going to be one of my takeaways from today. I'm going to switch over. I have a list of questions, but our audience questions are coming in strong and fast and hot. So I'm going to switch over to some audience questions to make sure we get a chance to answer as many of those as possible. And kicking us off with Dr. Rogers, I'm curious, and our audience was curious. Now that I read the question someone else asked, I'm curious too. Were there any assumptions that your team brought to the project ahead of time that were overturned when you started working with the community?
That's a really good question. I'll say this. I'm going to say yes, because we all go into work with assumptions and biases that we either acknowledge or don't acknowledge, right? But they exist, right? So we all go in with something, right? And so what I will say is, I had a really actually good conversation with one of my students that was working on this project, and she was participating in some of their committee meetings were like in the evenings, like 5-6 o'clock they would meet. And so she was, helping support. She was taking notes and things like that. And so as we started to capture the data from the groups, we started to talk about the priorities. There were some times where she'd see something like written down, or she'd like been at a group and she'd say, are you sure that's a priority? Like, I feel like it should be, blah, blah, blah. And so we had lots and lots of really good discussion, and it was an incredible learning moment, I think, for her to really get an understanding that how we operate at Sorenson and the work that we do around equitable work is under the belief that the people closest to the problem have the solutions. And so being able to say, whoa, let's pause here and let's actually look at what the data is telling us, right? Like, what are the transcripts saying about the recorded focus groups, or what was really said? Let's take out what we think or what we feel is, should be a priority. They know what is important to them, just like what's important to you. And so being able to take a moment and acknowledge the things that we don't know has been, I think, a huge learning opportunity for our team. And it is always an ongoing opportunity to learn for anyone who's engaged in this work.
Yeah, that's fantastic. Tiana, thanks for sharing. Next up, and this could go either direction. So Dr. Kuttner, Dr. Rogers, you guys can rock, paper, scissors as to who gets a chance to come in first. But yeah, he's ready. I'm curious for this answer, and one of the members of our audience asked it, who's works for a government entity. They said, how is this approach to community impact measurement and engagement applicable more broadly to other public spaces? I work for a government entity interested in how to incorporate some of these ideas. So any thoughts or advice for our participant here?
I can go first. So I'll say this, right? My early career started in public service. And so to me, it's, from my experience, I will say this. From my experience, the question is not how do you do it? The question is whether you really want to do it, right? And when I say that, I mean there's often conflicting priorities when you're working in the public sector because the community engaged social impact measurement is costly, and it's costly in multiple ways. It's costly in the time and the resources, right, that go into it. And right, we have to accept that it's not going to be a immediate solution all of the time, and you may not always see an immediate result. And so, as Dr. Kuttner kind of alluded to, it's like you have to engage and you have to commit to staying, right? And so that sometimes is not always attractive, not just in the public sector, but in any sector, right? It's not always the sexy thing to do, right? Because it can be laborious, right? To try to get multiple stakeholders at the table, to try to capture all of the voices, to also think about good conversation we actually had, Dr. Kuttner and I had maybe last week, was we have to consider who's not showing up to be a part of the conversation, right? And how do we account for that? And so I think because it's a mixture of head and heart work, there can be sometimes some resistance to really authentically engaging in the work. And so I think as long as there is a genuine desire and a in-depth understanding that it is intensive and laborious and can be resource intensive, it can be done.
Yeah, and I'll just say, I think there's a whole side to it that's about sort of the political will and how do you create space for that within your organization,
Mhm.
which we struggle with as well. I mean, we're also part of a government entity. We have our area, and this was for us, so we didn't have to fight it as much. But if we were trying to do this for, say, the entire university, there'd be a lot more sort of work to do internally to really understand this. One of the best ways I think for people to transform their thinking about the value of this is to actually get leadership into these spaces in community, doing this work on the ground and be able to see what's happening rather than having community be this abstract thing. And then I think, as our example shows, partners are key. You just need partners. I don't think any one institution needs to start from scratch going out to people necessarily, although that can be part of the strategy. So people who do outreach with us sometimes go to our Partners in the Park events, and hundreds of people are coming to these events in the parks, and that's a great way to talk to people you don't know already. So there's different strategies, but I definitely think finding the partners that really do have roots in whatever communities they are, and finding a way to support their work in tandem with yours, and that's often the hard part, and often involves money as well.
Yeah, yeah, that's helpful, and I feel like is a good segue to the next question from the audience that I wanted to highlight, which dovetails with a question I had as well. So the way I was planning to phrase it was, what do you do about the people who aren't in the room when you get feedback from the community? And then our audience member jumped in with the question phrased this way: with the snowflake model, how do you ensure you're indeed hearing the voice of the community and not just the leaders who maybe are in lockstep and maybe at times aren't? Or how do you give others the opportunity to engage in this community feedback loop as well? So maybe Dr. Kuttner, if you could lead us off on that, and then Tiana, if you have anything to add from this experience or from others that we've done, that'd be great.
Yeah, sure. So there's a few pieces here. I'll talk generally about the kind of snowflake model of engagement over time, because right now this was sort of one piece moment in time. I mean, when we talk about working with leaders, we're working very closely with them. We know what they're doing. We know who they're engaging. We know who they're responsible to. I think no one person can represent a community in the sense that we sometimes think of like a government representative represents a district. Like we don't expect any one person to represent a group. What we hope they can do, and we work with people who are good at it, is bring a lot of those other voices to the table.
Mhm.
Sometimes through stories, through sharing, this happened to one of our community members. This is a thing a group was struggling with, really concretely bringing those stories. And others is bringing people. So we do things that we could have decided in this to have larger events that brought larger groups together. In this case, that didn't make sense. But for other things, we will those leaders will then show up with 30 community members who they work with, who they want to engage. They have to be careful with how many times they ask those things. It has to be really valuable. But so we see that, like, over the years, we are engaged with them, through them, with their community. It's not like we never see them. So that's the sense. You start to learn who really has those connections and who can really be that conduit, that translator between, and often it's literal translator. A lot of our communities members, are bringing different languages to the table. The other piece is that, Marshall Gans, who developed the snowflake model, says, a leader's job is to develop leaders. So every step along that snowflake, you should be working to support people who maybe come into a program and get into a community just to get some services, but creating opportunities for them to step up into leadership. So you can get stuck in a place where you're over relying on a small set of people who get overburdened with trying to be the voice of the community, when you actually want to work with them to support other people in their communities stepping to the forefront, taking on different roles. And we actually have actually a third of our partnerships are focused just on leadership development. So we work with people who are already leaders, but everyone else is a leader or could be a leader if they wanted to step up. And so we have a lot of opportunities for people to take leadership courses, to be supported in developing their own ideas. And those partnerships help kind of create an ongoing group of people who are in a place where they feel they can step into a leadership role in different places. So yeah, you've got to continually be supporting that. And that's true on the student side, it's true on the faculty side, it's not just residents. So all of us kind of continually supporting that leadership voice coming up. The last thing I'll say is it's got to be ongoing. So this project just worked up with 3 groups. We only had like 3 months to do this. And so we worked with the groups we had, but my hope is that over the coming years, this will evolve. As we work with new groups, we'll show them what our indicators are, and they'll get impact. They'll see what kind of things we're collecting, and they'll give impact on their priorities, and it should evolve. So it's really not a one moment in time thing where you can say, this is the community's voice. Engaging community voice is an ongoing process.
Yeah, that makes a lot of sense. And so fortuitous, that leads us into the next question that I'd like to turn to. And I actually think because you play slightly different roles in this particular project, you might be able to answer this question from 2 different directions. How do you define success in a project like this? This question came in from David Press. How do you define success in a project like this? And how do you ensure that the efforts continue once a program, or I would say a project, right? UNP hasn't ended and hopefully won't, years of not leaving. But how do you ensure that efforts continue once a particular project ends? And so maybe take different pieces of that one. And Dr. Rogers, if you want to kick us off, that'd be great. And then Dr. Kuttner, from your perspective, how you would define success.
Sure. Thank you, Katie. For our team, we would define success as being able to do 2 things: capture the on the ground data and wisdom and insights from the community and helping them to prioritize those in a way that is meaningful to them. And then the second part is giving them the data, like what data pieces will help track the progress as they move the needle in a specific area, and helping them identify who's going to own that, who's going to, at what frequency are they going to collect information or data about this change, and what is it going to take as far as resources, time, money, all of those things. So being able to kind of set it up for them and saying, this is where we start. This is how often you're going to collect it. This is the information you're collecting. And that can look different depending on the project. For some projects, we build indicator dashboards for them to kind of capture information. For other projects, we're developing data tools. So like in this project, Dr. Kuttner and I had a working session one day where we just solely looked at his survey and went literally line by line of like, okay, what data is this capturing? Is it answering the question that you have, right? And so doing those kind of modifications in real time, to us, is a success. That is a success. Helping people understand the data that they have, understanding how to use it to answer the questions that they have is always my goal. when I'm engaging in any type of client work. So that's for us definitely how we define success.
Thanks.
Yeah. No, that's a good point. I think we've had some successes already. So one success is that the process was beneficial for the people involved. So,
Mhm.
the people, the community members who are the leaders who are in these groups, um, I think they felt like it was a useful conversation. So, a shout out uh, to Trent and Nikki and Brooke and Aaron Ram, who was part of an earlier one. They worked with us and some of the representatives from the groups to run really a visioning process. They envisioned the future of their community. They identified things from that they really cared about. They prioritized. I mean, that's a good process for a group to go through together as it thinks about what it's working on. So, and then you will be able to give them data on the things they care about. So I'm hoping that'll be helpful in the long run for them. For UMP as a department, as an organization, I think success is, for me, success is that these will help us learn and improve our work over time. It's not, there's less about a product and more just that um, we'll be able to implement and collect some data on these key things the community cares about, and it will lead to good conversations and dialogue about what's going well and what's not going well, and will help us in this ongoing learning action process. And I expect it just to continue going. I've been studying up kind of on what evaluation looks like from a systems lens, and a lot of people are coming to the point that, evaluation at this level can't be about predicting what's going to happen and then seeing if you were right and then saying how good you did. That it's really has to be more that the role of an evaluator is to foster ongoing learning. And so I really like that framework for it. We've had Sorenson was good at giving us sort of some layered recommendations. So, even just around these 5 priorities, what are things we could do immediately? And then what are things we could do with some more resources, and what are things we could do with a lot of resources? So immediately they said, well, the easiest thing to do, you already have a survey. What if you put questions about this survey for any residents who answer your survey? And so we did. And we haven't analyzed the data yet. We have data from something like 100 residents that are involved in our different, just to give some sense of what do they think the current baseline is on these things. So we're already getting some information, and then we can start to collect some existing data. I think there is a funding issue, and I know multiple people have asked about that. We have bigger ideas. For example, one suggestion that came from the Sorenson team was to put together a class or a set of workshops for a group. Say we pull together a group of partners who are working on the youth outcome and them going through a process of defining their own indicators, because our partners, we want to build their capacity to do this work, not just ours. And so we have some ideas that really do need funding, and we're trying to think about that. So we can make some of it work, but in terms of really deep ongoing community engagement in evaluation, that's going to take more resources than we currently have.
Yeah, that's such an important highlight, and leads me to the next question I wanted to highlight from our audience here. I'm curious for both of your perspectives on what the funding for community engaged impact measurement is like. This question comes in from Tristan Richard, as you can see on your screen. Is there an expectation of return on investment? And is it kind of expected to be unconditionally philanthropic? Curious for both of your perspectives here.
Okay, because I work at Sorenson Impact, there's never the expectation for anything to be unconditionally philanthropic. Like the intention, right, is for there to always be both and, right? So we want to do well while also doing good, right? And so with that in mind, when we think about how we think about impact measurement, whether it's community-based or otherwise, the whole purpose is to be able to quantify your efforts, to be able to share with external stakeholders or even potential investors how your efforts are moving something forward and having a positive or compounding impact, right? On whatever it is, right? And so when we think about that, you're only going to be attracting more investment, right? So how we think about it with UMP is if we come in and we help you put language, put numbers Also add some aesthetically pleasing graphics around what your impact is, right? So if a certain number of dollars are being put into your community effort, we can anticipate and project out what those return on investments would be, right? In most cases, particularly having worked in the social sector, there's not a lot of accountability or even transparency of what that process is, right? We see money going in and we see nothing really happening, right? There's tons of money put into nonprofits to address specific issues that we have yet to solve, right? And so we have to be more thoughtful and deliberate about how do we say, yes, this is the work that we're doing, and I'm going to show you, right? So impact measurement in community is about being able to show and not just tell that you are doing meaningful and important work that is creating an impact on a specific group, specific community, or addressing a specific problem. And so for us, it's always about how do we attract more investment?
I love that. Dr. Kuttner, anything to add? No, we just get a thumbs up on that one. That's it. I feel like that's the $1 million question. You know, everybody on this call is wondering, how do we fund this, and how do we justify funding this, right? If we're already spending an incredible amount of money operating programs, how do we justify spending the money then to evaluate those programs? And I think, you know, what Dr. Rogers just shared, and then what Dr. Kuttner shared in response to the last question, where your monitoring efforts can never just be monitoring and improving your work. They also need to be learning moments, right? And I know a lot of nonprofits have started calling that department monitoring, evaluation, and learning, right? And the kind of MEL, so that they know that this is always a part of the feedback loop. So thank you both so much for your answers today and for your engagement. I'm seeing we have even more comments and questions in the chat than we were able to get to today. So many great questions left unanswered. As we're going to run out of time here. As we wrap up, know that if your question was asked in the chat and we didn't get to it, we'll try to provide answers to the questions in our follow-up to this webinar. As a follow-up to this webinar, you'll get the recording and the slides, ways to connect with Dr. Rogers and Dr. Kuttner if you have further questions. You can note in the chat as well. All of our LinkedIn links are there. We invite you to engage with us. We'd be excited to connect and excited to continue the conversation. And excited to continue the conversation of engaging in some expertise in community related impact measurement. Community involved impact measurement is something that you or your organization would like to be a part of. So we're so grateful for everybody who was able to join us today. And Casey, if you'd bring up that last slide, that'll put up our contact info as well. You can pull that link either from the chat or from our last slide. We would love to help anyone who's interested in knowing more, showing more clearly, and growing the impact of their program. Thank you both for being here, and thanks to everybody for joining.